It is a common saying that health is wealth. This explains continuous advocacies at different fora on the need for people to prioritize their health, which is in tandem with the mission and vision of the World Health Organization (WHO) in commemoration of the World Health Day. To mark this year's World Health Day in Ekiti State, community dwellers in Ikole local government areas at a town hall meeting in Ikole Ekiti were enlightened on the theme of this year, Our Community, Our Health. The general overview and the activities of the Ministry of Health and Human Services, as well as the agencies, boards and parastatals under the ministries as they have affected the various communities under the local government areas, were also enumerated. The special assistance to the Governor on Public Health, Dr. Jimlas Ogunshakin, highlighted the effort of the state government at making healthcare services accessible to the people at the grassroots, which he said were pronounced at the various healthcare facilities across the state. The State Commissioner for Health and Human Services, Dr. Oyebanji Filani, said government has impacted on the people of the local government through availability of personnel, drugs and facilities at the primary and secondary health care facilities in the local government areas. He explained that government is working out means at making health care accessible through health insurance scheme and give matching order that every state-owned hospitals in the state is to attend to any emergency patient, registered or not, and effect the registration afterwards.
As a state, we consider the single most important thing life of the individual and your well-being. And so if a patient should go to a hospital on an emergency basis, yes, we recognize that data is important. Yes, we recognize that it's necessary that you put the registration done, but you have to see the patient. If when you are saying doing registration, the patient dies, then what's the value? We have a center here in Ikole within the State Specialist Hospital that will manage cholera. We've worked with our colleagues at the federal, both the NCDC and the Federal Ministry of Health, to now have a fully functional, world-class, public health lab that can address every single ailment of disease outbreak in Ekiti.
The chairman of Ikole local government, Shola Olominu, traditional rulers, religious and community leaders acknowledged the impact of the Fayemi-led administration on the local government and appealed that such should be extended to other areas yet to be touched. Our COVID-19 vaccination and free medical check-up at the program. From Ikole Ekiti, Ayodi Jogunshakin, NTA News.